Health in Madison, Dane County have issued a health alert due to a spike in drug overdoses.
From July 13th to the 14th, there were 5 confirmed overdose response calls from EMS. It's more activity than we usually see here in the area, and it's still unknown what's driving the spike, but resources are available. Joining us now to talk about that, Ramona Gomez from Safe Communities. Hi, thanks for being on with us. You know, I always want to start when we hear about people who struggle with substance use disorder or any type of addiction. They're not just numbers. Someone loves them. They are human beings. Do you keep that to the forefront of the work that you do?
Oh, always. I always remember, like, they're somebody's family, somebody's brother, somebody's sister, like, all those things.
Yeah.
Very unexpected, too. So what could have caused such a sudden spike? I mean, you can guess, I know, but as the expert, what could have caused that?
I mean, a lot of things, you know. It could be a bad batch. It could be, you know, maybe when dealers are doing it, they're putting extra things in there. Like, we really don't know.
Yeah, and I know one of the big concerns here in Dane County and all over, and you alluded to it, dealers, cartels lacing things with fentanyl. That seems to be driving a lot of these things.
Oh, 100%. Like, even, you know, I always say kids are going to do what they're going to do. People are going to do what they're going to do, but let's teach them harm reduction. Like, even test your weed. You never know, like, what could be in it.
And there's a fentanyl test, which is something many people don't know about.
So we carry these around, like, I always keep them in my backpack when I'm at work because it's an easy test. Like, they give you everything that you need to test it, even directions on the back to make sure, like, you're getting what you're getting.
Again, we don't want to say go and do illegal drugs, but if somebody out there has a problem and needs to test that first, it can save a life.
100%. Same with the Narcan, like, never use alone is a big thing. And again, like, not saying to go and use, but, like, you're gonna do it regardless. Like, let's try to be safe so somebody doesn't have to call your mom and let them know.
Yeah. And I've noticed, you know, in the conversations that we've had with officials here, including Safe Communities, increasing access to Narcan, and Narcan is basically a fentanyl reversal in these situations when you see someone having suffering from fentanyl poisoning. I see there are vending machines. You can find them at different community resources. Has increasing access to these life-saving things, has that been a big priority?
I think so. I think it's a really big one to people to know that they can just go and get it and they don't have to feel like shame. Like, if people come into our office, we don't ask any questions. We just give them the Narcan.
Also, we were reading about how the heat may actually be playing a role in this. Like, so many overdoses in a couple of days. How is that possible?
Well, I don't really have an answer for that one, but I would assume that not drinking enough water, you know, dehydration, all that.
Yeah.
Well, and before we go, we have an available 24/7 Safe Communities hotline up there. People can call 608-228-1278. If they need any extra help, they can find someone.
Yeah, they can. We work on that 24/7, 7 days a week. We get calls from hospitals and we go into the ER and sit with that person in a time of need.
Very good.
And anybody can call that number.
Anybody can.
Good to know.
Ramona, thank you very much.
Yeah, thank you
for joining us.